Hey everyone, welcome back to our place. And if it's your first time here, welcome as always. Today we are so excited to have Dr. Brandi Tanner. She has over 20 years of experience working with children and adolescents with learning and behavioral problems. She's both a licensed psychologist and a certified school psychologist. She started her career as a special education teacher, but then decided to return to school for her doctoral degree in school psychology. Currently, she is providing and conducts comprehensive psychological and psychoeducational evaluations in her private practice, Lightway Psychological Services. She's helping families learn about evaluation, reevaluation, and even helping families navigate IEPs. So thank you, Dr. Brandi. We are so excited to have you today.
Thanks for having me. I'm excited to share information that can help families.
Yeah. So I think let's dive right in. Evaluation, obviously, super tough topic, especially when it's the first time getting your child evaluated. And I think where I want to start is where most parents start. You know, your kid is maybe in preschool or even a little older, and you hear from a teacher, something doesn't seem right. So I don't know, maybe go have them evaluated. And parents then go, okay, so where do I go? What do I do? What does that mean? So what advice could you give parents who are, just hearing that for the first time?
I think the place to start with that idea is to think about different reasons for doing an evaluation, because there's more than one. Some families are hesitant to have their child evaluated because they don't want their child to be labeled, or they're kind of concerned about what happens with the system, or where do my records go, or things like that. Some important benefits of having a thorough evaluation of your child's skills would be, if they need some extra help, having those documented diagnoses can help you to access services that can help your child. Another thing is, information from a thorough evaluation can help with treatment planning. So if we've done a really comprehensive assessment and we know specifics of what your child's strengths and weaknesses are, then we can make up a treatment plan and a learning plan that's going to help them progress a lot further and a lot faster. So the benefits to moving forward with that, if you're feeling apprehensive about it, would be, if you have documentation to show that your child needs these services, it can help them to be able to access it. And again, knowing the specifics of what's going on, that helps you to know exactly what kind of treatment plan to put in place to help them.
And would you recommend that they start with a psychologist? Like, first place they go when they hear that is starting there, or should they start with their doctor and maybe they could refer them to someone?
A lot of people, their initial contact is with their pediatrician. And a lot of people tell their pediatrician, I'm worried about my child's speech development or their motor skills or how they're learning and things like that. So a lot of times pediatricians will make a referral out to a psychologist if it's a learning and development issue, to a speech therapist if it's a speech and language issue, occupational or physical therapist if they're concerned about what their motor skills are like. So talking with your pediatrician is potentially a good first step, because that can help you know what professional do you need to go to get the assessments that you need. As far as learning and development, also social emotional issues, attention concerns, that is typically an evaluation that is by a psychologist. So
Okay.
if that's the main areas of concern, that's probably where you're going to go. And then myself as a psychologist, sometimes once I get in there and start working with a kid, I might notice some language problems or some motor skills problems and refer out to those professionals if needed.
Okay. And I think too, like, it's probably fairly common. Like, parents probably hear a lot, whether it be ADHD or autism, there might be something that you want to get your child evaluated for. So I think knowing too, you're not alone in that space.
Right.
So when a child is getting let's talk about first evaluation. So they found somebody, they talked to their pediatrician, say they're coming to you to get that first evaluation. Walk us through what the parents can expect.
So if you're going to have an evaluation by a private psychologist, typically what we do first is to have an intake appointment. And that would be where we would get all the information from you about what are your child's strengths, what's working for you, what have you done that seems to help, what are your areas of weakness, what do you see as the difficulties that you want to get some more information about so that we can check it out further. So we're usually doing a pretty detailed interview about all of those strengths and weaknesses that lets us know these are the areas that we need to make sure that we're including in the assessment. And also, we probably have you complete some paperwork that will have developmental history information, some information about how your child is currently performing so that we can use that to plan out the battery of tests.
Okay.
Next, your child would be participating in the actual evaluation. So depending on your child's age, their skill level, things like that, it could be 1, 2, sometimes 3 or 4 appointments if kids have short attention spans, they're younger, like there's difficulty on a certain day or something like that. But usually that's some one-on-one work with the psychologist, do an assessment of their cognitive skills. If there's an educational question, assessing their academic skills. You would also complete some rating scales so that you can give us information about in the home setting, what types of things you see about their social skills, emotional and behavioral regulation skills. And then we put all that information together from what we heard from you in the interview, what we see in the test scores from working face-to-face with the child, and what we have from the rating scales that you complete to try to get a bigger picture of what's going on and how we can help your child best. Once we've got all that information together, we're going to compile a report that explains all that information in detail. Then we have a feedback appointment with you to discuss those results, talk about what the recommendations are, if there are any particular interventions, strategies, therapies, services that could be helpful to your child, and kind of walk you through ideas about what the next steps would be to get the services or supports that your child needs, and then give you a copy of your written evaluation report so that you have documentation for anybody that needs it. So
Okay.
that's kind of a quick overview, start to finish, what you might expect to go in for an evaluation.
And when you do that, because I mean, obviously you're getting a ton of information from the parents, from the child, and I know in a lot of things, like for the waivers, you have to come with a lot of information and they give you like a checklist of some sorts. But in this process, especially if it's the first time, they don't have to come with anything, do they? Or are you guys walking them through that entire process?
No, I mean, myself personally, I start with kids that are as young as 3 years old. Other colleagues of mine are working with kids that are 2 or even younger than that. So, as soon as you start to notice some issues, we can get in there and get started with them right away. Like I said, I'm going to do a thorough interview with you, and I'm going to have a history form so that we can get all your medical history and developmental history. But other than that, it's not like, applying for Katie Beckett or something like that, where you're bringing in a massive stack of paperwork at the very beginning.
Okay.
We kind of talk you through everything so that we can get a picture of what's going on and get a plan in place to help.
Okay. And I think I do want to talk about, because we also come across this a lot. So I think when you're first hearing it, you're going, oh my gosh, this is a lot. Like, this can be overwhelming. So for the parents who are maybe either the single mom and dad, or even parents who are both working, is there like a time that you would say, okay, I would make sure that you can set aside and commit to this amount of time to go through this evaluation process? Or like, how would you recommend handling that as a single parent?
Um, you know, every psychologist and every practice has their own set of procedures about how they set up appointments and things like that. I do feel safe in saying that you're probably going to have at least 3 appointments: an intake appointment, a testing appointment, and then a feedback appointment. And then, like I said, depending on how much testing needs to be done and how much your child can tolerate on one day, it might be a couple of days of testing. I myself like to have a really quick turnaround time. So I try to get all of that completed, like within a month if possible,
Okay.
to have your multiple appointments, get your report written and get the information to you so you can start getting the help that you need as quickly as possible. I know that some other practices have longer timelines, or, like if you can't come back in right away, like week after week after week for appointments, we can work with you and flex around that. But we're going to need a couple of appointments. Also now, since everybody has gotten used to Zoom and virtual, some of those appointments can be done remotely.
Okay.
So, particularly the feedback appointments, sometimes the intake appointments, I really like to lay eyeballs on a child for an evaluation and not do a remote assessment. But some of that could also make things a little bit easier as far as how many appointments, getting days off of work and things like that.
Yeah. Okay. I mean, it always doesn't hurt to ask too, like for parents who ask if virtual is an option, because in the world of COVID, I know that that's changed a lot, a lot of things. So you have these evaluations, and we hear a lot that schools can do these evaluations, or you can have a private evaluation done. So for a parent that's going, okay, do I do the school one? Do I go private? What's the difference? Is there a cost difference? What would you say about that?
There are several differences between a school and a private evaluation, but there are also several things that are the similar or the same. So as far as, are we probably going to do a cognitive assessment? Yes. Are we going to do an achievement assessment if it's needed? Probably. Are we going to, assess all the skills? Yes. Are you going to get a written report when it's done? Yes. Are you going to get a list of recommendations? Yes. So some of those things, like the testing part itself, is the same. The parts that would be different would be the rules and procedures about how you go about getting all of it done, and what you can do with the information when you're finished. So on the school side of things, schools are testing for eligibility for special education programs. So they have a list of categories, there's 13 of them, and they're doing an assessment to figure out, does your child meet the criteria for one of these categories, so that we can provide special education services to them. So that's the main focus of a school evaluation. In a private evaluation, that is to give your child a diagnosis. So on the private side, they're not bound to, we've only got this list of 13 different eligibility categories. In our statistical manual that we use as psychologists, we have hundreds of different variations, and we can get really specific about, rather than just saying at school, other health impairment would capture ADHD. We can really get specific into, this is ADHD, anxiety, depression. This is a medical diagnosis of autism. So, if you need that to prove to your insurance company that you need ABA therapy and speech therapy covered, you have the documentation that you need. So again, schools are testing for eligibility. Private psychologists are doing evaluations that are going to lead to an actual diagnosis. On the school side of things, that service is available to you free of charge. They're going to have to do some procedural things along the way, in addition to, like a psychologist and therapist or whoever needs to assess your child. They're going to be collecting some data about how your child's responding to interventions. So there's going to be some paperwork, some procedural red tape, an intervention period, and things like that, in addition to just having the evaluation completed. In the private side of things, things that you want to consider would be, if you go to a private psychologist, you get a diagnosis, and then you take that report back to the school. It doesn't automatically qualify them for school services. Sometimes the school eligibility criteria and the diagnostic criteria that a private psychologist uses, sometimes they line up really nicely and there's no issues. Sometimes they don't line up as nicely, and even if there's a diagnosis in your private evaluation, it might not guarantee that you're going to get school services. Also, insurance companies vary widely in what they're going to cover and what your out-of-pocket expenses are going to be for a private evaluation. So most commonly, insurance companies will cover what they deem to be medically necessary procedures. So if we're looking at medical diagnoses like potentially autism, ADHD, anxiety, depression, things like that. Insurance companies consider those to be medical conditions. And if we need to test to figure out if your child has one or more of those conditions, they're typically okay with paying for us to do the assessment to give one of those medical diagnoses. When we start getting into my child's having trouble with reading, writing, math, they consider that to be an academic or a school issue. They don't think that that is a medical issue at all, so they don't want to cover it. So sometimes your insurance will cover it if it falls under that medical necessity category. Other times they won't cover it, and they almost never cover the academic testing.
So you said too, because when people are starting off, a lot of them are going to their pediatrician. So if they're getting the recommendation from their pediatrician to have these tests done, could that be a way for, because it's coming in as a recommendation for insurance to cover it because it's coming directly from the doctor?
Excuse me, sometimes yes and sometimes no. It's going to get down to that question of medical necessity and what your insurance company deems to be something that is a medically necessary service. So again, like if we need to do some further assessment to figure out if your child meets the criteria for one of those medical diagnoses, they're usually okay with us doing the test to see if they meet those criteria, or, you know, like which one is it that your child has. When we start getting into, let's test your academic skills, or I think there's dyslexia, I think there's a learning disability, that's when they really kind of shut the door and they're like, school should be handling that. We don't consider that a medical issue and we're not going to cover it.
So what about, because I mean, we've talked a lot about IEPs, and it's kind of, are parents told exactly what their rights are when it comes to an IEP, and are they transparent about that? And so I'll ask the same question here with the evaluations. Are these parents expected to ask the school for the evaluation, or is it the school's job to say, okay, you know, you guys can get an evaluation and it is free to you?
Whoever it is that recognizes that child is having difficulty can start the referral process for an evaluation. Sometimes it's just the teacher notices, hey, you know, like Johnny's not catching on, you know, like maybe we need to look into this further. So sometimes the referrals come from the school, just, you know, like from what the teacher notices. Most schools have screening procedures in place now where they're doing assessments with all of the students a couple of times a year. And if your child is scoring below a certain threshold, that's automatically going to get them on a list. Like, this is a student we need to work with more. They might potentially need an evaluation going forward if that extra help isn't sufficient. And then you as a parent, regardless of, you know, like if the teacher noticed something, if your child scored below the threshold on those screeners, if you as a parent have concerns about how your child is doing, you can also go to the school and make the request for that evaluation. So it can come from any of those channels. I have worked with several parents before that they're the ones that are making that request. And there are some things that you can do to kind of speed the process along and make it go more smoothly. But it can come from any direction, but a lot of times it is parents that are making the request to move it along a little faster.
And so let's talk about timeline a little bit, because you brought it up. So how long can parents expect it to take if they're in the school system? Once, you know, they hear from a teacher maybe, or they ask for an evaluation, how long until that evaluation is actually happening?
I'm going to start with what the rules and the law say about this, and then kind of work backwards out from it.
Okay.
Here in Georgia, our state regulations say we have 60 days to complete an initial evaluation. So that's somebody that's getting tested for an IEP for the very first time.
Okay.
So when that 60 days start is when you sign a form that's called consent for evaluation. And they need a signature on a paper to say you're giving permission for them to do the evaluation and assessment with your child. So, you know, if we just look at it on its surface, it should take 60 days to evaluate your child. What I have seen from other parents is that they're asking for the evaluation and they're having meetings and they're being told, you know, like, well, let's wait and see, or things like that. And even though, you know, like they voice their concerns, they're not getting to the point that they sign that consent for evaluation form. So they could kind of get stuck in that limbo period for quite a long time. When you sign that consent for evaluation, that's when it's going to start your 60-day timeline. And there's a definite endpoint at that point in time. Once you sign, within 60 days, you're going to be holding an eligibility meeting, and you're not going to be caught in that kind of limbo period. I just recently wrapped up working with a family that his mom showed me emails and meeting notices and things like that for over a year. She had been asking for an evaluation for her son. And then like we wrote a really specific letter to request that evaluation. We used some keywords in there like, like I suspect that my son has a disability. I believe that he needs an IEP. Consider this my direct parent request board evaluation. When they received that, they moved forward. She signed the consent for evaluation. And between January to March, he went from having nothing to now he has an IEP with the services that he needs. So for some families, it takes a while. And those are some of the things that stalls it out. It doesn't have to take that long though.
And what would you recommend to families that are being told, oh, well, let's wait and see, or give it a little bit more time, and, they feel strongly that they want it done within that 60-day period and they want to sign that form?
One of the things that I have seen have the best outcomes is making that written request, like I mentioned before. You want to write that letter and use those keywords, special education, disability, IEP, things like that, because that's going to trigger them recognizing they need to be following the parental rights as it applies to kids that have disabilities.
Okay.
So kind of the broader picture is there's a part of the special ed law that's called child find. And if there's a suspicion that a child has a disability, then the school system has the responsibility to evaluate that child and see if they need extra services. So that's what it falls under. And then when you write that letter, I always suggest getting it into the hands of whoever is the school level person that's in charge of special education, because when they see your letter with the word special education, IEP, disability, they're going to understand, hey, the special ed rules apply to this. We're going to be on a 60-day timeline, and they're probably going to put it forward a lot faster and easier.
So maybe not just giving it to the math teacher, but finding out who the special education director at your school is and reaching out to them. Okay. Yeah. So that's a helpful.
Yeah. Those are the people that are in charge of compliance issues. Like, they get in trouble with the State Department if they're not following, like the rules and procedures, meeting their timelines and deadlines and things like that. And if you get into a situation where you've been asking and not getting the evaluation, then you potentially could go down to the State Department and file a complaint against them because they're not evaluating your child who they suspect has a disability. So getting that person that's in charge of those compliance issues and knows the ins and outs of those laws is probably going to get more action than people that's not the focus of what their position and job is.
Yeah, because we actually talked to a special education teacher here in DeKalb County, and a parent asked a question about how often are you guys updated on policies and procedures? And he kind of said, we're usually the last ones to know. And so sometimes it's just a confusion of maybe a parent's going to a teacher and the teacher's going, I have no idea what to do with this. And it just needs to be known to the teacher and to the parent. Okay, find out who's in charge of your school, go to the special education department, and they're the ones that are supposed to handle it. Because the teacher might not know.
Right.
So say, you have a child, they were told at a young age, they need to get evaluated. They've gone through that entire process. They've had their evaluation done a few years ago. And then you have the parents that are going, is this something I do once? Is this something I'm supposed to do every 3 years, 5 years? Do I ever get my child reevaluated? What does that look like?
On the school side of things, your school team is supposed to be addressing eligibility every 3 years. So whenever your child gets evaluated and placed in special education the first time, 3 years later, the team is supposed to discuss, do they continue to need special education services? So that can look a couple of different ways. Usually maybe like, 6 months in advance or maybe even longer of when that eligibility deadline is going to come up, that 3-year renewal cycle. The team will have a discussion about, do we need to have a thorough comprehensive evaluation all over again? Or do we have enough information just by looking at the level of progress, goals and objectives, report card grades, what we know about how the student is doing currently, to say that they still meet the criteria to keep receiving special education services? So what happens sometimes is they'll have that discussion. The team will say, we have enough information to say they still qualify for special ed without doing updated testing. And they'll just kind of reset the renewal date for another 3 years without doing testing. Not always my favorite thing to do because, if you, going back to what I said at the very beginning of the presentation, part of it is to check off a box, like, yes, we meet the criteria for this condition that requires special services. But the other part of it is, do we have updated information about how this child is functioning so that we can use that for treatment planning, for planning out what they need in their services and things like that. So, I don't like for it to go way too many renewal cycles without doing testing. I always suggest to parents, your 3-year is coming up. If you want the school to go ahead and do a new evaluation, make sure that you speak up and make that known, because a lot of parents have come to me and they're like, oh, wait a minute, I don't even remember having this discussion. And now they said that, my kid's not due for testing, we already skipped our 3-year. So kind of have on your radar, if it's coming up, you can look right on your IEP and see what the eligibility date is and when it ends. So, several months in advance, make sure that you're paying really close attention to those decisions being made in the meeting. And if you want your child to be tested again, make sure that you speak up and make that known. In addition to just having updated evaluation information in their file because they need it for special ed records or for an IEP, if you're need an updated evaluation for Katie Beckett. If they skipped over your 3-year reevaluation, you don't have that, then you've got to go out and get a private site from somebody, and you might have to scramble if you're short on time. Then, there's potentially a cost to you too to do that. Another reason I don't like to skip over reevals for too long of a period of time is you just don't have up-to-date information to make decisions about that student and how they're doing. Years ago, I used to be assigned to some high schools, and we would be in decision-making meetings about these high school students. And then they would call me in as a psychologist to talk about, what are the implications of their most recent psychological evaluation? And I would open up the folder and see, oh, the last time that you were tested, you were in 2nd grade, and you're in here sounding out 3-letter words, and now you're sitting here old enough to drive a car. And I can't use that information to make decisions about you because that psych report is years old. That has nothing to do with how you're functioning now. So definitely don't let it go too long, and be aware that sometimes when that renewal cycle comes up, the recommendation will be made to just continue them without updated testing. But those are some of the potential pitfalls that could happen if you let that go too long and not have updated testing.
Yeah. Okay. I want to break that information into 2 sections, because I want to talk about just maybe the people who aren't receiving waiver but are getting evaluations done for IEP. So if they at the 3-year mark go, I don't think we need to have a reevaluation done right now, can they reevaluate again in a year? Or if they pass that 3-year mark, are they waiting another 3 years?
They don't have to. If I understand you correctly, it's the 3-year cycle went by and then you realize, oh, they should have done a new evaluation on my kid, but they didn't. To be honest with you, it's going to be harder to open that discussion back up when it's not a part of their normal timeline and procedures. They're ready to discuss it when that 3-year renewal is coming up. They know it's going to be on the table, and they're probably going to be much more likely to fall in line with what you want and go ahead and do the evaluation if it's truly actually time for them to do it procedurally. Outside of that 3-year window, you can ask for it. It's probably going to take a lot more prodding to get them to do it, because it's not within their timeline cycle that they were planning to bring that up and address it with you again. But it could happen.
Okay. And then the other thing I wanted to ask, because you mentioned, you see high school students that haven't been evaluated since elementary school. So for the students who are college bound or college eligible, I know that colleges provide some fantastic services, especially for people who have learning disabilities. So like private testing rooms, longer testing times, similar to high school. So is that, you probably want to have an evaluation done before you go to college, if that's the path that you're taking. And do you know if colleges take evaluations that were done in that at that school level to qualify them for services?
Yes, they do. And what I would suggest is, if you have any idea what schools your child might be interested in attending and what schools are on the table, go to the website for disability services, accommodation office, whatever it's called at that particular institution, and take a look at their criteria for what kind of documentation are they going to require to put accommodations in place for that student. Most of the time, again, this is not for every school, but the most common scenario that I've seen is they want testing that is within 3 years, so not older than 3 years. And they also want an evaluation where the student has been tested using adult measures. So one of the main common IQ tests that we give is the Wechsler Intelligence Scale for Children. That goes up to age 16. 16 and older, we give you a test called the Wechsler Adult Intelligence Scales.
Okay.
So when families are trying to pregame this and plan it out, if it's at all possible that you can game plan that around, let's do that testing around the time that you're turning 16. That's going to cover you through, like you're going to college when you're 18. So you're still within that window. You could use that evaluation then. And if you do need to have a psychological evaluation to show for accommodations are needed for SAT, ACT, those types of things, you will also have had updated testing that you can, like submit for college board accommodations as well. So it's kind of like killing two birds with one stone.
Okay. Yeah.
If you're able to get it within that time frame.
Yeah. And I think that's important to note too. I mean, I think there's so much conversation around IEPs and accommodations for elementary and middle and high school, but there definitely are fantastic accommodations as well for college level students.
Right.
And universities are fantastic I personally actually was a note taker at my college for the students that had disabilities and stuff like that. So it goes outside of high school.
Yeah, definitely.
Okay, so now let's shift, because we did talk about the Katie Beckett waiver. And I have talked to a lot of families that go, you have to have an evaluation done to continue to receive waiver. And an evaluation can cost $5,000. And it's kind of a management of the school doesn't necessarily tell me that I am entitled to that and I can do that, and will that work for Katie Beckett waiver? So talk to us a little bit about evaluation when it comes to waiver services.
Okay. I'm going to do the best that I can to kind of stay in my lane with what I know and not jump into what I don't know, because I don't want to give any misinformation.
Right.
You probably know the answer to this better than I do. I don't know if they accept school evaluations or not. I think that they do, but I'm not sure. I just know on the private side of things, a couple of things that could help families out would be, like I do a pretty fair amount of those evaluations, and I have in the past. They're going to always want a cognitive assessment. They're going to always want an adaptive assessment. And if autism is one of your child's diagnoses, they're going to want some sort of measure that documents you still have symptoms of autism spectrum disorder. So we want to make sure we're at least assessing all of the areas that they're going to be looking for. It is going to, at first on the surface, be kind of a check a box, like, do we have this? Do we have that? Are the scores in the range for somebody that will qualify? So making sure that you get everything that you need in the evaluation, that's a part of it. As far as working around the timing and the fees and things like that, with the timing of it, again, like if a school evaluation will cover it and you can have it within a time frame that's going to be accepted by both, that would be ideal. If you do have to go to a private provider, if you go to a provider that is in network with your regular health insurance and Medicaid, then hopefully that would mean, like whatever your insurance was supposed to pay, they would pay it, and then Medicaid would pick up the rest of that. So, if you can find a Medicaid provider that can potentially offset the cost of doing the updated evaluation. So the trick to that would be, like the number of providers that accept Medicaid is a smaller number. So there's potential to be booked out weeks and months into the future. So if you're waiting until the last minute, availability for appointments is going to be difficult. If you have a longer window of time to be able to get into somebody that's in network with the insurances that you need, then there's potential for it to be covered.
Okay. And then something we'll have to look into is if an evaluation is required to be done every 3 years as you move to the now and comp waiver. Do you know if that's the same case?
I typically am just kids and teens,
Yeah.
so I don't know with certainty. I don't want to give an answer and it be wrong, so I'm not sure about what their requirements are.
Yeah. Well, we have an entire segment on the now and comp waiver, and I know that they talk a lot about evaluation and timing, just like you were talking about. And so that's something that we'll try to find a little bit more information on and get back to everybody, because I know that that's, crucial in getting your waiver. But I do know you can get on the wait list for now and comp waiver when you're in that high school age. So you can use the evaluations that you're getting at that young age to at least get on the wait list for that application and that very long process. So any reason why somebody would not like that you would say, you know what, an reevaluation is probably not necessary? Is there ever a case where you would say that?
Potentially on the school side of things, there's one area where I might exercise a little bit of caution before asking for updated school testing. If your child's disability is mild, and like they're getting along relatively well, they're not needing like a really high intensive amount of services, there is a potential that they could test out of services.
Yeah.
Like if we tested them again and maybe like you had a learning disability and your academic scores used to be really, really low. So we worked with you for a while, like you got your school services, you got extra tutoring outside of school, and you kind of remediated that skill gap. So it's not as large as it was. Your scores are not as low as they were in the past. In that situation, you could potentially test out of services. So that would be the one situation that I'm thinking of where you might want to exercise a little bit of caution before pressing really hard for the school to do additional testing.
And you can refuse it, right? So like if school's going, we need to do it, and you're in that category, you can say no, right?
They're not allowed to proceed with an evaluation unless you signed consent for it.
Okay.
So, each individual case would work itself out in a different way there, but, that is a hard and fast rule. They can't do the evaluation without your consent.
And they can't remove accommodations either, correct? They can't just make that decision without testing.
Typically, whenever you're in your IEP meetings, that's when the team is talking together about what goals and objectives are we going to have, what accommodations are we going to have. And so you would be talking about all that together as a team decision. If you weren't in agreement with your team, that would be kind of like a whole nother sidebar issue outside of the evaluation piece. If they want to remove services, though, it shouldn't be like, well, we just decided that you're great now and you don't need it anymore. In order to exit out of services, like I've had an IEP in place for several years and we think you don't need it anymore, they have to test you out. They can't just, decide, like, we're just going to wish you out. So
yeah. Okay. Which a lot of people have had their IEPs removed too. So that's
Mhm.
a key thing. Okay, so let me pull up here because we did have quite a few questions submitted. Obviously, a lot of hot topic around evaluation, and some of them you may or may not be able to answer around medication. But so the first question is, my son is getting reevaluated soon, and he has moderate autism, severe ADHD, and an intellectual disability disorder. What tests should I request?
Um, for that one, it's not so much about requesting specific tests. It's making sure that you get an assessment of all the different areas that your child is having difficulty. So, for an intellectual disability, we want to try to get a good assessment of what the cognitive skills are. I myself would probably, in that case, select a test that's considered to be a nonverbal IQ test, because there are some that have a lot of language and verbal loading and require verbal responses and have heavy verbal instructions that the child needs to understand. So a cognitive assessment, and in that specific situation, probably a nonverbal assessment, some sort of assessment that is going to assess what is the level of the autism spectrum disorder symptoms, some sort of measure that's going to assess what is the level of the ADHD symptoms. So making sure that you're getting all the parts covered, that's going to be more important than what specific test are the person going to give. Another piece with intellectual disability and autism is to get a thorough assessment of their adaptive behavior skills. So that's their self-help skills, because that's really useful information for treatment planning. Like what are that particular child's strengths and weaknesses, so you know what areas or skill deficits that you need to fill in. So I don't like to ask for specific tests, but just make sure that you are getting all of the areas that we need to assess, that they're all covered by some piece of the assessment.
Okay, so for other families who would be going through the same thing, just effectively communicate, this, and this, and we need to be looking at this, and this.
Mhm.
Okay. How can I get my child placed into a self-contained classroom?
That question is kind of starting with the evaluation piece and then taking it down the road into the IEP piece. First of all, you want to get a good, thorough assessment that documents what are all your child's areas of concern. So, like, is it a cognitive or learning issue? Do they have behavioral issues? Figure out what all is going on and get that documented. Then once your child is eligible for services, the next place would be you're going to go into your IEP, and they're going to need to make an IEP that addresses all your child's needs. So with the present levels of performance, you're going to start with, we just had an assessment that shows, like we've got weak skills here, here, and here. From that present levels of performance, then you're going to move into what goals and objectives do we have for this student that they need to work on. Once you know what the goals and objectives are going to be, then the team would talk about those goals and objectives that we just said the student needs to work on. Could we address those in a general education classroom? Like, if this child is supposed to be in second grade, is that what they're doing in a second grade classroom? If they're not, that's when they're probably going to pivot more towards the decision of they're not working on those skills in a regular classroom. They are working on them in a self-contained classroom. So it's kind of that placement decisions are like the last stop of the train. So making sure you get a good, thorough evaluation. They write all the weaknesses into the present levels. You get goals and objectives to address all those areas of weakness. Then that kind of puts the writing on the wall of we're going to need a place where they're actually going to work on this and address this.
So be patient.
It sounds well, be patient, and also the steps at the beginning are critical. Like if they didn't do a good, thorough evaluation, you're not going to have those weaknesses documented clearly. And if you don't have the weaknesses documented clearly, it's going to be hard to make a case for going to a self-contained placement. So starting at the beginning, realizing we need to get all these weaknesses documented, it's going to help you steps down the road.
Okay. How long after an RDR meeting is reasonable to wait for his reevaluation? This parent has been waiting a year and 4 months so far.
That is a very long time. I'm going to guess by RDR, they mean reevaluation, determination, review meeting. Back at the beginning of our talk today, we talked about an initial evaluation has a 60-day timeline. So that's really clear. Like you sign the consent for evaluation, within 60 days, they got to be wrapping it up with an eligibility meeting. That 60-day rule, unfortunately, does not apply to reevaluations.
Oh.
When we were talking earlier about, like that reevaluation cycle is every 3 years, the actual hard and true technical on paper deadline is whatever the eligibility date is on the IEP when it's going to run out. So sometimes they'll, they'll talk to you about it like a year in advance to make sure we got you on the school psychologist list. We're going to get you tested within this time frame. But technically speaking, their hard deadline is not until that date. In my opinion, over a year, that's like way too long. I feel like that one should have been wrapped before that. Out of a sense of, like empathy for school psychologists and everybody that is working in a school setting, COVID caused a huge logjam backlog of students that needed testing. And then when we got back in-person school, like all of those kids that had been waiting had to be tested. And it's just taken a while for it to clear out. So, I mean, it's a systems issue. It's a staffing issue. I'm sure that whoever is responsible with that team didn't want it to be that way. It's probably factors that are outside of their control. But yeah, over a year, like, think about if you had the information from that evaluation a year ago and it could have been into practice in your child's programming that long ago, like that sounds like a serious issue.
So any advice on what they should do in that situation? I know when we talked about the initial evaluation, very clear email or in writing to ask for special education services to the special education director. So if you're waiting and there's not a requirement for that 60-day,
if it's over a year, they should have at least have one IEP meeting because you have to do that at least once a year. Whenever you're having your meetings, you want to definitely bring up your concerns, make it known that you want that information. Again, like it's differentiating out, is this a checkbox we want to check off if this child is eligible, or do we really want to go further and have this information so that we can use it for treatment planning? One of my own personal pet peeves as a psychologist, and particularly when I used to be a school psychologist, I would write up a long, beautiful, like 15, 20 page report. Somebody would just open it up to the last page and be like, yep, SLD, slam it back in the folder and go on about their business. And I'm like, no, that's not what this is for. This is to help you understand this child better and know what to do to help them. So I would lean into it from that standpoint. Like the procedural side is going to be harder to win because technically speaking, like they're within their timeline, but leaning into, we need to have this information to help this student, that's probably going to be a stronger case.
And we discussed in our IEP content, you can ask for an IEP meeting. Mm-hmm. Like it does not just have to be once a year, once a semester. You're entitled to ask for an IEP meeting.
Right. Like I said, like they would have at least had to have had one within that cycle because once a year is required. But if you feel like your child is not doing well, if you feel like they've already met everything on their IEP and you want to take them to the next level, if you're having issues and you don't think they're getting their right instruction, any of those reasons or other things as well, you can always ask for an IEP meeting in addition to just the one annual review.
Yeah. So maybe also she could start there. Mm-hmm. Okay, so this is shifting topics a little bit. So do you have any suggestions about what to do if one feels like their child's psychiatrist is not listening to what they are asking for or saying? This kind of goes around, this woman is talking around, she's been prescribed medication for her child's been prescribed medication that she doesn't know if it's a right fit.
Okay.
And I don't think she's saying that she feels heard, that she wants to evaluate alternatives.
Okay. medication issues are getting outside of my wheelhouse just a bit. So for psychologists, we're mainly focusing on doing assessments and then doing therapy or behavioral interventions to help kids. So we have a psychology degree and we're coming at it from those particular standpoints, assessment and treatment through behavior and therapy. Psychiatrists are medical doctors. So they went to medical school and they're the ones that are going to be prescribing medications to you. So, there are things that the doctor's probably taken into account, like physical things that are going on with your child, like their age, their size, their weight, things like that. That's probably part of their decision-making process for what medications they're trying. If you're really not happy with how they're addressing your needs, you might want to see, is there another another psychiatrist that you could work with? Talk to your pediatrician about, do they feel comfortable prescribing the medications or not? Sometimes for cases that don't have multiple diagnoses, it's just one thing at a time. Sometimes pediatricians feel okay writing those prescriptions themselves, but usually if it's we've got 2 or more things that we need to address with medication, they're more likely to want to refer out to a psychiatrist, because that would be a medical doctor that specializes in mental health types of medication. So
what about the reverse though? So if you are seeing a psychiatrist and they're kind of, maybe you feel like you're getting medication pushed on you, and like you said, there are a lot of therapeutic options for people. What about going to a psychologist to see if there are options for therapy outside of medication? Could that be an option?
Yeah, it can be. And they often work well hand in hand together, because medication is going to do whatever it's going to physically do to alleviate some of the symptoms that you're having. Whereas if you are doing behavioral strategies and therapy, that's also going to teach you skills that you can implement when you need them to help you regulate your emotions and regulate your behavior. So when I'm working with families, that thing that I just described of doing behavioral and therapeutic techniques along together with medicine, though that's usually for a lot of conditions, that's going to be, what gets you the biggest result is to do both of those together. I, a lot of times I'm talking to families about, especially for really young kids, let's exhaust all the behavioral strategies and therapy that we can, just because I personally am not a big proponent of putting medication into a tiny body until it's absolutely necessary.
Yeah.
So trying to exhaust as many behavioral and therapy strategies as you can, and then moving on to the medication. And then again, if it is a matter of you still feel like you're not being heard by that psychiatrist, it might be time to look for a different provider that you feel like connects with you and your family's needs a little bit better.
And we also talk about that in another session of how do you break up with a doctor that you don't like, because you can, and there's options for that too. Well, that was the only questions that we're going to be able to cover today. But if somebody is looking for assistance or evaluation, tell us a little bit about Lightway Psychological Services. Obviously, your information is also going to be on our website as one of our experts. So if they need to talk to somebody or get connected, they can find all that information on our website. But tell us a little bit about your practice.
Sure. Actually, I kind of wear 2 hats. I do have my psychology practice, which is Lightway Psychological Services. I specialize in evaluation, so evaluations only. I have a lot of good professionals that I refer out to for therapy and other treatments. I start with kids as young as 3 and go up to high school kids. We talked earlier about kids that are graduating from high school and need updated testing to go into college. So that's kind of like the upper bound of kids that I work with. Doing evaluations for learning and behavioral issues, autism, ADHD, learning disabilities, anxiety, depression. So those are the types of families that I work with. And again, I like to approach it from the standpoint, not just we want to label your child, we want to put a diagnosis on you. I feel like the most important part is okay, we have more updated information about what's going on. So now we have more specific information about how to treat it, how to get your child some relief, and how to get you some relief. So that's what we do. I also provide special ed advocacy services. My advocacy business is your IEP source. So having kind of straddled the fence between I used to be a special ed teacher and a school psychologist, I kind of have an idea of what they might be saying or doing behind closed doors. And I take that information and use it for families to help them kind of pregame for when you have an IEP meeting coming up, what you should say or do to maximize the chances that you're going to get your child the services that they need.
Okay.
So those are kind of the two different ways that I help families, and try to take the mystery out of that whole evaluation piece and which one is going to be best for you and how you can use all the information you get to help your child.
Okay, awesome. Well, I know that this is going to be so helpful. We've had so many people shoot us comments, emails, questions, because obviously the whole evaluation, reevaluation is a very hot topic and hot issue for a lot of families. So we cannot thank you enough for answering the questions. You have been a wealth of knowledge, and definitely reach out to her if you would need to utilize her services. And don't forget to register an account at our place so you can tell us what your 3 biggest needs are right now. We're going to take those needs, and that's how we're going to target the awesome content and the awesome interviews like this one that we go to next. So again, thank you so much. I appreciate your time.
Thanks so much for having me.